Welcome to Season 4 of Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health. I'm Josh Sharfstein, Vice Dean for Public Health Practice and Community Engagement and a former Commissioner of Health in Baltimore City. Our goal is to bring scientific evidence and experience to current topics in public health through engaging interviews with scientists, community leaders, policy experts, public health officials, clinicians, and more. If you have ideas or questions for us to cover, please email us at publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes.
Hey listeners, I'm Lindsay Smith Rogers, producer of Public Health on Call. Today, Stephanie Desmond talks to Nadia Aksier, a researcher at the Johns Hopkins Bloomberg School of Public Health and a native of Afghanistan. They discuss what happened to health the first time the Taliban were forced from power there, and how desperate the situation has already become now that the Taliban have returned to power. Let's listen. Nadia Aksier, thanks so much for joining me.
Thanks for having me, Stephanie.
So today I'd like to talk about the situation, the healthcare situation in Afghanistan. And first, I'd like you to tell me a bit about the research that you did for your dissertation, which I understand had to do with what happened in Afghanistan when the Taliban came and went.
Absolutely. So for my dissertation, I studied maternal and child health and nutrition in Afghanistan. Importantly, we looked at the progresses the country had made since the first Taliban government ousting, which was in 2001. At that point, when the the United States government came into Afghanistan and occupied, Afghanistan had some of the worst health indicators in the world. Maternal mortality was as high as 1,600 per 100,000 live births, which was one of the highest in the world at that time. And similarly, childhood malnutrition, chronic undernutrition was 60%, meaning more than 1 in 2 children in the country were chronically malnourished. And many other indicators were abysmal as well. So what we wanted to do was to understand, back in 2011, 2013, around that, let me start again. Back in 2011, when I started my PhD, at this point, more than 10 years had passed. We thought, well, what are the progresses that have been made? Lots of money has been channeled into the country. Has there been any gains? And so I did my dissertation for 7 years. I studied many different data sets, over 13 national data sets that have been collected in the country over the period of 2001 to 2015. And we produced papers that were published in The Lancet and other journals. And what we found was that the country made dramatic progress. So that maternal mortality rate that I mentioned, 1,600 per 100,000 live births, dropped by 75%. So at the point when I finished my data collection, which was 2015, maternal mortality ratio was actually 400 per 100,000 live births. And the childhood and newborn mortality rates had also dropped by about 30% in the country. Malnutrition had dropped from 60% to 40%. The access to healthcare services such as antenatal care and delivering in a healthcare facility had gone up from about 12% in the early 2000s to about 40%. So huge gains made in the country. Obviously, rates of mortality and undernutrition that were still really poor, but the country had made progress.
Mm-hmm. So by seeing that, what did you attribute those improvements to?
Yeah, in our study, we tried to understand exactly that. What were the gains made, and what were some of the drivers? And we ran a series of different types of analyses. And to summarize, some of the key factors that came out were as follows. Improvements in maternal education and empowerment were a huge driver in almost all outcomes: nutrition, access to healthcare, reductions in maternal mortality. It was always the case that a woman getting educated or going to school was a huge driver, and that has many different pathways through which that operates on women and child's health. Also, the deployment of healthcare workers such as midwives and nurses in the country were very important. Afghanistan made huge investments in the midwifery program, and that resulted in direct gains to children being saved, babies being saved during delivery, to women being saved, and various other outcomes as well. The improvements in reducing poverty levels, although Afghanistan is still a very universally poor country, they did make some improvements in reducing poverty. That was important as well. Those are some of the drivers, and there are others as well.
Now, I understand that you were born in Afghanistan.
Yes, I was.
And you have family and friends still there?
Yes, I do. In fact, my entire extended family, aunts and uncles and cousins, they still live in Afghanistan. Just my family, my immediate family, my parents and my siblings. So we were able to leave in 1989 during the first, the Soviet invasion at that time.
So tell me what you have learned about what's been going on since the Taliban came back to power recently.
Yeah, so since the Taliban came back into power in August of this year, really, the country has turned upside down almost instantly. It was a shock, I think, to the country and to everyone really around the world how quick it happened. And there have been many things that have happened since. So almost immediately, donors, long-term donors in Afghanistan, such as the World Bank, the IMF, and the European Union, who have been funding the healthcare system for the country for over 15 years, they froze their funding and suspended it effective immediately. So what that means is that there was no money for the health facilities in the country. There are 4,000, almost 4,000 health facilities. Okay, let me start again. There are 3,500 health facilities in Afghanistan, and within a matter of weeks, 2,000 of them had shut down because there were no funds. There were no funds to keep the lights on at the health facilities, to pay health professionals, or to buy the commodities such as essential vaccines that are needed. Also, many Afghans had their money in central banks frozen because the United States government froze $9 billion in assets that were sitting with the central bank. And that is the money of the people of in the country. So their assets were frozen and there was a cap on how much money they could pull out. It was $200 a week. So people didn't have money, and they still don't have money because the cap still exists. They don't have money to buy food and things that they need for their daily livelihood. And these people are already poor. So the limited money that they did have that they were putting in banks, they now don't have access to. There are also vaccines, COVID vaccines that have, spoiled over 3 million doses of vaccine sitting in Kabul fridges that there's no one around to administer. Women are not being, allowed to, or women are not mobile freely at this point. They're not encouraged to leave the home. And so what that means is that there aren't any female health workers or limited female health workers. And in the Afghan culture, a woman must provide care for a woman. So it's very important to them. And if the women are not leaving the home, that means that there are no women in health facilities to care for children and women who come in. Girls and women are, related to that, not going to school. And there are huge restrictions on those who can. So these are some of the issues. There's a huge healthcare crisis and food insecurity crisis going on at the moment. And there are fears that the entire country is going to collapse, within a matter of weeks.
Didn't you tell me that a cousin of yours had to give birth alone?
Yes, actually. So one of my cousins who live in a rural part of Afghanistan, in eastern Afghanistan, but our village is by Jalalabad city. I was speaking to my mom and she said, "Oh, your cousin, she had her baby." And I was like, "That's great, Mom. Did she go to a health facility? How did she do it?" She said, "No, nobody was home. She had to deliver it herself." And this is a young girl who is it's her first child. So the first pregnancy is always high risk for women everywhere in the world. Now, this young woman is an adolescent, so she's 21 years old, very young, so she's in a especially high risk group. And then on top of that, nobody was home, not her mother-in-law nor her husband or anyone else, and she delivered the baby herself. She said she didn't realize she never delivered before. She didn't realize she was going into labor, and then she ended up, luckily, they're both doing okay now, but that's the reality of what's going on in the country. That's just one example, very close to me, but there are probably thousands going on right now as we speak.
Mm-hmm. Are there efforts afoot to try to help?
I hope so. And, there are humanitarian agencies that are still active in the country. So for instance, all the healthcare healthcare services in Afghanistan are provided predominantly by NGOs, international NGOs such as Save the Children or UNICEF or MSF, and then also local NGOs. And though most NGOs have suspended activities because of no funding, there are some NGOs such as MSF that have continued their activities there. So there are some limited efforts going on. Again, they're operating in a difficult context where insecurity is a huge question, and also there are limited resources and limited health professionals. So there are some humanitarian efforts, but not nearly, what's needed to keep that country afloat and to keep people healthy and safe.
What are you doing to try to make things right?
So I'm a researcher, a healthcare researcher, and having done research in Afghanistan, intimately for my dissertation, I know what gains the country can make. And I think there are many different players in Afghanistan's healthcare story that have contributed to it, including, being the government, but beyond the government, the NGOs, civil society, the diaspora, researchers such as myself, importantly, the healthcare professionals who are there currently, and also those who have fled. And I think these, stakeholders need to come together and brainstorm and think about what can we do with the skills, experience, and assets that we have and the networks that we have to prioritize health and have it protected at all costs in Afghanistan. And so within Johns Hopkins in the Department of International Health, I'm currently leading a working group. We are calling it Mission Afghanistan 2030 to line up with the SDG era goals ending in 2030. And what I'm hoping to do is to bring these various stakeholders together as part of a task force or a working group to align on the research, evaluation, advocacy, and impact opportunities that are available or that we need to find to support health in Afghanistan. And when I hope through this working group that we can synergize our efforts and discuss joint funding opportunities and collaboration, that we can build a network of Afghanistan-focused health researchers and health professionals from around the world, and really serve as a coordinating body for these various stakeholders to align around a common agenda. Some of the work that I've done with the Exemplars and Global Health Program at Gates Ventures, I found that a common agenda such as One Health, One Plan has been key to success in improving health and development in many exemplar countries. And Afghanistan currently does not have one of these common agendas. There are many players in the past and limited now, but everyone's kind of doing their own thing, coming in with their own projects and ideas based on their country's agenda and priorities. And so I think organizing ourselves around a common agenda is very important, and these stakeholders that I mentioned are key to that. So I'm hoping this working group can lead initiative to do that as well. And to lead that as well. And then finally, to work together to influence and advocate with these long-term donors and other donors to reactivate the healthcare funding that these Afghans so direly need.
Are you surprised at how quickly this fell apart?
Personally, I was not surprised. I knew, the Taliban are from the country. They've been there. They're born, bred, taught. They know the culture. They know their country very well. The fact that the United States was there for 20 years and continued to fight off the Taliban over those years. And, they were the largest kind of group working against the United States government. It wasn't surprising to me that as soon as the USA left, the Taliban took over. I think I was surprised at how fast it happened, immediately within a matter of 2 days. I don't think anybody expected that, but not surprised at all that the Taliban have taken over again. And I think at this point, I would really push the entire world to think about this new government. Yes, they are the new government, and they are recognized as terrorists or whatever it might be in around the globe. But I think they're trying, and because they're there, and they really, if the most powerful country in the world could not beat them out, I think that's a sign. Maybe we need to give them a chance and just see what they're going to do. And that doesn't mean let's, cooperate with them immediately and give them all this money. I think it's just the idea of giving them a chance and letting them show us what they can do to protect the civilians of Afghanistan and really be able, and really be there for them to support as needed.
And you feel that we should give them a chance, even though they created such a mess with the healthcare system before?
I believe that we have no choice because they are there and they are currently the government and they will remain there. And we need to be thinking about how we can protect the 40 million Afghans who are in the country, who are getting sick, disabled, and dying every day. And so thinking about the people, yes, I do think we need to work with the government. I think it's not ideal, but I think it's the only option at this point. We need to be careful how we approach it, work with them in a way where they can gain our trust as an international community and really collaborate with us on the priorities. But yes, I do think it needs to be done. And also, I feel that the Taliban that are there currently, this is a different generation of Taliban. This has been 20 years. Many of the youth, the young kids, have grown up in this globalized world as well. They're on the social media. They are doing the things that youth and adolescents are doing all over the world. And these guys are the front line of the Taliban. So I think this is a different generation of Taliban who may be a bit more open-minded and open to discussing and having a dialogue with the rest of the world on what we need to do to protect health and civilians in the country.
Nadia Axier, thank you so much for joining me.
Thank you so much for having me, Stephanie.
Public Health on Call is produced by Josh Sharfstein, Lindsay Smith-Rogers, and Stephanie Desmond. Audio production by Spencer Greer, Niall Owen McCusker, and Matthew Martin with support from Chip Hickey. Distribution by Nick Moran. Production support from Catherine Ricardo. Social media support from Grace Holes Fernandez and Caroline Wong. Thank you for listening.